Are you suffering from OCD or chronic anxiety and depression? Have you seen psychiatrists and psychologists, done cognitive behavioral therapy, done the Prozac and the Xanax and all the pharmaceutical options, and notice no improvement? Then your OCD, anxiety, depression, your neurocognitive issues may be driven by a metabolic driver. And if it's a metabolic driver, then all the psychotherapy in the world will do nothing to change your state if you do not address that driver. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. In conventional medicine, an OCD issue, a tic issue, an anxiety issue, depression issue, these are all addressed from the psychiatry or psychology perspective. So it's all in the head, and we're going to address that with psychotherapy and with SSRIs, benzodiazepines, those sorts of medications. The problem is that there are many, many possible metabolic drivers for those neurocognitive issues that the psychiatry world, the conventional psychiatry world and psychology world will never consider, such as nutrition and diet, gluten reactivity, celiac disease, autoimmunity, blood sugar dysregulation, chronic infection. All of these things could be driving or causing the OCD, the tics, the anxiety, the depression. And if they're not found and addressed, then you'll never improve. So can you see how fundamentally important the question of, is it psychiatric only, or is it metabolic only, or are both involved? Can you see how important the answer to that question is? The answer to that question determines the path, the clinical path that has to be taken from there. If it's psychiatry only, then psychiatry is the way to go. If it's psychiatry and metabolic drivers, then psychiatry only will not get you where you need to go. You have to address those drivers. And if it's metabolic only, psychiatry will never get you where you need to go. You have to address those drivers. For example, if someone has chronic OCD or anxiety or depression that's escalating in severity, it's not uncommon for family members to look for an inpatient facility to check that person into. The problem is, you could check that person into that facility and spend thousands upon thousands of dollars for that person to be a patient there and get zero improvement if it's an autoimmune process, okay? Because that facility is doing nothing to evaluate and treat the autoimmune process. They're treating this person as a psychiatric patient only, and psychiatric from a conventional standpoint. So before spending the thousands and thousands of dollars to check someone into an inpatient facility, it'd be more efficient and care could be better served if you know, is this purely psychiatric, or is there a metabolic driver that is not going to be assessed over there or addressed over there, and therefore that person will not get better unless we assess and address that. So as I've stated previously, we don't want to practice insane healthcare, doing the same thing over and over and expecting a different result. A different psychiatrist or a different medication, if tons of them in the past haven't helped you, is not going to lead to a new result. It's going to lead to insanity. You have to try something new or look under a different rock, okay? So assessing, if you've been down that path and never looked at the metabolic side of things, or only looked at the surface metabolic things, and a deeper dive down the metabolic route is what you need to determine what drivers are involved, okay? That is functional medicine. That is how we look under the hood and say, in this person with a history and complaints of neurocognitive issues, is it purely up here, or is it coming from all over the place? The answer to that question determines care and prognosis and long-term quality of life in that person.